The psychiatric system as a mechanism of social control and pharmaceutical dominance. A conspiracy grounded in evidence, history, and patterns of power. The core claim is straightforward and increasingly difficult to dismiss. The modern psychiatric system is not primarily a benevolent medical enterprise dedicated to healing mental illness. Instead, it functions as a sophisticated tool of social, behavioral, and ideological control. Its operating principle is compliance. Conform to societal norms, authority structures, and approved beliefs, or face labeling, pathologization, forced medication, and loss of autonomy. Psychiatrists operate analogously to police or inquisitors. Everything you say can and will be used against you. Dissent from their worldview, or the broader status quo they enforce, risks a diagnosis that justifies intervention, often chemical. This isn't fringe paranoia. It's a pattern visible in historical abuses, diagnostic unreliability, pharmaceutical capture, adverse outcomes, and real-world enforcement mechanisms. Historical precedents. When psychiatry polices thought and behavior. Psychiatry has repeatedly served power by pathologizing nonconformity. In the mid-20th century, the lobotomy craze, promoted by figures like Walter Freeman, turned thousands into compliant shells via ice pick procedures through the eye socket. It targeted the difficult, institutionalized, women, minorities, and the socially undesirable, often without meaningful consent. The procedure won a Nobel Prize in 1949 but is now recognized as a tragic example of medical authority overriding welfare to enforce docility. In the Soviet Union, sluggish schizophrenia, diagnosed political dissidents for reformist delusions or anti-authority views. They faced chemical lobotomies via heavy tranquilizers like reserpine. This wasn't aberration. It mirrored how Western systems can medicalize dissent. In the U.S., pre-1970s psychiatry pathologized homosexuality as a mental disorder until activism and cultural shift forced its removal from the DSM. Critics like Thomas Zosch, a psychiatrist himself, argued in The Myth of Mental Illness, 1961, that mental illness is often a metaphor for problems in living, used to exert social control rather than treat verifiable biological disease. Zosch faced professional marginalization for challenging the orthodoxy. Challenging psychiatric viewpoints has led to institutionalization, loss of rights, and ruined lives. Involuntary commitment laws allow detention based on subjective danger to self, others judgments, where refusal of treatment can itself be evidence of illness. Your statements in sessions become charted symptoms. The diagnostic trap. DSM as subjective tool of control. The DSM, Diagnostic and Statistical Manual, is psychiatry's Bible, yet it's built on committee consensus, not robust biomarkers. Most categories lack objective tests, unlike, say, a blood sugar level for diabetes. High overlap between disorders, poor inter-rater reliability in some studies, and expanding criteria. E.g., broadening depression or adding new labels. Medicalize normal distress, grief, or eccentricity. Financial conflicts exacerbate this. Analyses of DSM-5 and DSM-5-TR panels show 60–69% of members with pharmaceutical industry ties, totaling millions in payments. This influences which disorders get codified and treated pharmacologically. Critics note the DSM's role in FDA approvals and insurance, creating a pipeline from diagnosis to drugs. Disagree with the psychiatrist's worldview, e.g., on politics, gender, authority, or lifestyle. It can be framed as paranoia, oppositional defiant disorder, or delusional thinking, especially if you resist treatment. Everything you say is documented. Express skepticism of the system? Lack of insight, a classic justification for forced meds. This mirrors police interrogation. Your words build the case against you. Pharmaceutical dominance and forced compliance. Psychiatry's toolkit heavily favors drugs. Pharma funds research, key opinion leaders, guidelines, and continuing education. Negative trials are buried. Positive ones amplified. Antidepressants, antipsychotics, and benzos generate massive revenue while promising chemical fixes for complex human suffering. Involuntary outpatient commitment and court-ordered treatment enforce adherence. Noncompliance, refusing pills, proves illness, justifying escalation. This creates a cycle. Question the system. Right-pointing arrow labeled ill. Right-pointing arrow medicated into compliance or sedation. Verified harms and death toll. The human cost. Psychiatric medications carry documented risks, including increased mortality. Estimates and data include: one analysis estimated psychiatric drugs, neuroleptics, antipsychotics, benzodiazepines, antidepressants, as potentially killing approximately 209,000 plus older Americans annually via excess mortality. Conservative figures using FDA and cohort data on cardiac effects, falls, etc. Updated U.S. figures suggest hundreds of thousands in broader impacts. Over 21 years, greater than 51,000 psychotropic implicated deaths in one dataset. Medical and external causes. In 2014, psychiatric medication overdoses outnumbered heroin, 15,778 versus 10,574. Benzodiazepines drive many polydrug deaths. SSRIs, antidepressants. FDA black box warning for increased suicidality in youth, young adults. Risk roughly doubled in trials, 4% versus 2%. Some studies link longer use to higher sudden cardiac death risk. Antipsychotics, associated with metabolic syndrome, sudden death, and excess mortality in severe mental illness cohorts. SMRs 4+ times higher. These are not fringe claims, drawn from FDA data, cohort studies, CDC overdose stats, and peer-reviewed analyses. Underreporting in systems like FAERS is common, true toll likely higher. Many deaths stem from cardiac arrhythmias, falls, metabolic issues, or suicide linked to akathisia. Drug-induced agitation. Patients report being dismissed when raising side effects, that's your illness returning. Tapering is often unsupported, leading to withdrawal. Horrors misread as relapse. Why the system cannot be trusted. 1. Lack of objective science. Many disorders are syndromal, symptom clusters, without proven etiology. Shaw's critique holds. Absent clear pathology, it's often behavioral control. 2. Institutional capture. Pharma influence on DSM, trials, and guidelines creates bias toward medication over therapy, lifestyle, or social solutions. 3. Power imbalance and incentives. Doctors face liability for undertreatment, but little for overmedication harms. Institutions profit from beds, drugs, and compliance. Dissenters risk career ruin. See critics like Zosh or whistleblowers on overdiagnosis. 4. Historical pattern. From lobotomies to political abuse to today's chemical sedation, psychiatry aligns with prevailing power. Cultural, corporate, state. To enforce norms. 5. Outcomes data. Despite massive increases in prescribing, mental health disability and suicide rates have not dramatically improved in population terms. Some metrics worsened. Excess mortality in treated populations persists, turning skeptics into believers. The darkness exposed. Consider the asymmetry. If you challenge a cardiologist's statin recommendation with evidence, debate ensues. Challenge a psychiatrist's diagnosis or refuse meds, you risk being deemed incompetent, sectioned, or having rights stripped. This isn't medicine, it's enforcement. Real dangers. Iatrogenic harm. treatment caused illness, lifelong dependency, suppressed autonomy, and a chilling effect on free thought. Vulnerable groups: poor, minorities, dissenters, trauma survivors bear the brunt. The system pathologizes the human condition under stress, poverty, isolation, abuse, meaninglessness, then sells chemical obedience. This isn't claiming all psychiatry is evil or no one benefits. Some find relief, and severe cases need support. But the dominant paradigm incentivizes overreach, minimizes harm, and prioritizes control via do as told or pills. Evidence, from history, conflicts of interest, death stats, and enforcement, makes denial unreasonable. Questioning it isn't illness. Ignoring the pattern is willful blindness. Demand informed consent, biomarkers over checklists, non-drug options first, and accountability for harms. The darkness is real. A system promising liberation that often delivers chemical chains. Awareness is the first break.